My name is Dr. Armando Rojas, and I am an OBGYN physician at HCA Florida Citrus Women's Health. Where I am in my career, I find myself being 99.9% a gynecologist. I do very little pregnancy care at this point in my life. So I do a lot of minimally invasive surgery. We use something called a robot, and we do something called robotic assisted hysterectomies. And there's a lot of other stuff that we can do with the robot. Things such as urinary incontinence. Women, they leak, and we do bladder suspensions and, a lot of minimally invasive type of stuff. When you do the robot, it's still the surgeon that does the surgery. We put the same trocars in, but there's no motion at the actual incision site because the motion is distally at the end of the robot tip. So these patients wake up and they have, I'm not going to say that they don't have pain, it is surgery, but they have very little pain. So if we can get them home day of surgery, that's advantageous to the patients. Communication is the key, right? Some professor taught me someplace that if you can get a great medical history, you will make the diagnosis 85% of the times before you even lay your hands on the patient. So communication, right? So if you can get a good medical history, find out what their symptoms are, and there's a lot of pressure, because we see a lot of patients, and my mission is, I'm going to give that patient as much time as they need. I've been doing this now in this community for 29 years, and I said I don't deliver patients very often, but sometimes I'll do a C-section on a woman that has had a previous C-section, for example. Well, isn't it great that I actually delivered her, nowadays? So I see them back, 26, 27, 28 years later. Now that it's her first or second kid or something like that, and I got to deliver not just the mom, but her baby as well. That's very gratifying to me.